Hi, my name's Alice. I'm a speech pathologist with IPC Health in Sunshine, and in this video I'm going to talk about typical speech and language development and when to seek help. So I'll talk about why speech and language are important and what speech and language disorders are. Answer the question about how important speech and language milestones actually are, and then we'll go through each of the milestones for different ages. And then a quick discussion about bilingualism and language development and how to get help if you have any concerns. So speech and language obviously allow us to express our needs and our wants and our feelings. They allow us to interact with other people and make friendships. But we might not also realise or think about the fact that language is important for our thinking and essential for our learning. Speech and language are very closely related to literacy, so children who have speech and language difficulties often have difficulty with learning to read and write. So speech and language disorders, about 1 in 5 children when they start school have difficulties with their speech and language, and of those some of them do catch up and others go on to have a language or speech sound difficulty that continues throughout school. It is, like I said, linked to literacy difficulties. So if you're having trouble with your speech sounds or language when you start school, that can make learning to read and write a bit more difficult. And also we know that it's linked to other factors like social-emotional development, behaviour, educational outcomes, and then later down the track, employment. We're still trying to understand the causes of speech and language disorders, although we do know that there's a genetic component, so they tend to run in families. There's a neurological component, and also a child's environment, so the experiences and conditions that children grow up in, as well as things like medical factors like having fluid in the ears, all shape how a child develops their speech and language. So how important are the milestones? A lot of people say, look, all children are different, they develop at different rates, she'll talk when she's ready, that sort of thing. And that's quite true. And a lot of children who don't meet this speech and language milestones, particularly the early ones, a lot of those kids do catch up even without speech therapy. However, they're considered to be at risk of a speech or language disorder. And we also know that if we help these kids while they're quite young, they do better. So what we actually recommend is if your child's not meeting the milestones, do arrange a speech pathology referral, and then your speech pathologist can help look at the risk factors for your particular family and child to decide whether or not they need therapy straight away or perhaps monitoring for a little while. And of course, just make sure you're providing lots of opportunity for speech and language learning through book sharing, play, and talking during daily routines and that sort of thing. So at 12 months, what we expect is that most babies or toddlers can understand about 10 words. They look when you call their name. They might recognise and also use some common gestures like bye-bye or clapping if you've been practising that, making eye contact, babbling still at this age, and copying some sounds. And at 18 months, they can usually understand up to 50 words that they maybe hear often, follow little instructions like throw the ball. Maybe when you're looking at a book with them, they could point to some things that you ask them to. And at this age, we hope that they can say at least 6 to 20 single words, so maybe mummy, more, ball, and so on, up to 20 words at least. A lot will be doing a lot more than that at this age. But if they're not meeting those milestones, you might consider arranging a speech pathology assessment. And at 2 years following instructions that have 2 parts, like give me the ball and the car, answering some simple questions like what's this or where's daddy, pointing to some body parts. And in terms of what they're saying, we expect at least 50 words at this age and joining words together So, for example, bye, mummy, mummy, car, that sort of thing. And I'll talk about the sounds a bit more later. And at 3 years, most kids can follow more complex instructions like give me the teddy and throw the ball. Understanding questions like what and where and even who questions, so who's driving the car, and understanding some basic concepts and colour concepts. In terms of their speaking, they're usually using sentences at this age, at least 4 to 5 words in length, and starting to ask questions themselves, and maybe talking about things that have happened in the past and having a basic conversation. And at 4 years, they can really answer a lot of questions, understand most types of questions, so what, where, who, even maybe some why and how questions at this age. They're starting to join sentences together using and but and because, describing things that have happened or even making up their own stories, and starting to use the pronouns like he and she correctly, and me and you, and don't, and that sort of thing. And at 5 years, following even more complex instructions with 3 parts, like put on your shoes, get your backpack and line up outside. They're starting to understand concepts to do with time, like before and after and now and later. And usually at this age, if they've had some opportunity to learn it, they're starting to recognise some letters and numbers, and they use more complex sentences, and the grammar is right a lot of the time. They might make a few grammatical mistakes like saying throwed instead of threw the ball, but apart from that, the grammar is really coming together now, and they can tell stories that have a start and a middle and an end. And in terms of speech sounds, these are the different sounds that we would expect to be correct at different ages. So you can see at a young age, children develop these sounds first. So p, b, m, d, n, h, t, k, g, w, ng, like at the end of ring, f and y. And then by 4 years, we would also expect, as well as those young ones, that they could say l, like in lion, j, j, and ch, and sh, s, v, sh, and z. And then some of the later developing sounds include the r sound, like in ring, and the zh, which is in the middle of measure, and then th, as in this. Those ones we really expect around 5 years. And then finally the that's in thing, around 6 years. So what about bilingualism and language development? So learning 2 languages doesn't actually cause a language delay, but there are some children who have speech and language difficulties regardless of how many languages they hear and speak. So there are some kids who are bilingual who have a language delay, just like there are some kids who are only exposed to one language and have a language delay. And when that happens, the difficulties would be in both languages. So bilingual children should develop their milestones at a similar rate to kids who speak one language, but across the 2 languages. So at 2 years, we expect around 50 words that they can say across the 2 languages. It's normal for them to mix the 2 languages together while they're still learning them, and then as their language systems become more complete, they'll start separating them out. So just a couple of quick tips. Speak the language that you're most comfortable with. Try not to mix the 2 languages together in the same sentence, because you will teach a mixed code if you do that. Try and keep them separate. You could have one person, one language, or just one activity, one language, or one language at home, the other language out of the house, or just your home language at home, and wait for them to go to kinder and school to learn English. They will need to hear the language often enough and in good quality activities to actually speak it. So if your child is not speaking much of one of the languages, it suggests that maybe they're not hearing that one enough, or maybe not in good quality activities like book sharing or play. So how can I get help? So if you notice that your child's perhaps not meeting a few of those milestones, the first thing we would suggest is to arrange a hearing test. Even if they were fine at their newborn screen, there are a fair few children who have difficulties like fluid that comes and goes in the ear that causes a hearing difficulty that we might not be aware of and that can be managed. So it's really important that we rule that out. Organise a speech pathology referral. So if you want to go for a public service, you can come, if you're in Brimbank, to IPC Health, and our phone number's on the screen there. If they're already at school, then they'd need to go through the school-based services, or another option is to see a private speech pathologist, and you can look them up on the Speech Pathology Australia website. Remember, you can always speak to your maternal and child health nurse or your GP if you're having some concerns about growth and development. And if you're very concerned, and particularly if you have concerns about other areas of development as well, I would definitely ask your GP for a referral to see a paediatrician who can assess your child's overall development. And if you're wanting to read a little bit more, I recommend the Raising Children Network, which keeps their information very much up to date, and the Speech Pathology Australia fact sheets, and those are where I've got the information for today's talk. Thank you and all the best.